What's up, respiratory world? This is our Portex tracheostomy tube. Smaller diameter, no cuff, so this is not for any ventilated patients. That translucent clear piece on top is the in the cannula. We insert and remove in the cannulas for secretion management, maintain patent airway. So if this in the cannula gets impacted, we can remove it and replace it with another one, or if we're unable to suction the patient. This cap or button is used for capping the patient. Once the physician feel like they are ready for possible decannulation in the near future, they'll put the cap on to allow them to breathe through their upper airway, nose and their mouth, into their lungs. This here is the operator that facilitates the trach going into place. So when we're inserting the tracheostomy tube in place, removing the old one or replacing it with a new one, or when the doctors are putting it in place for the first time, they'll have to use the operator to help facilitate getting it in place. Our Portex, this is size 6. This one is fenestrated. This helps with vocalization through the fenestrated hole. So you remove the inner cannula to help with vocalization, but we don't use the fenestrated ones that frequently. We typically don't use the Portexes as much. They've been using the newer version of a tracheostomy tube that we have now. But yeah. Respiratory world, this is our Bovona silicone tracheostomy kit, tracheostomy tube. So have the length of this thing. It's pretty long. It is size 8, 11.7 millimeters, length 130 millimeters. So this is for a tall individual. It has the flexible tubing, as you can see. Stylet already in place, extra long, not stylet, obturator, extra long obturator in place. This is for patients going to be on mechanical ventilation. You see they have the pilot balloon there. I'm trying to remember if this one is the one that you can inflict reward. I'll take my word for it. But it has a button there, so you know when you go to occlude the trach, you will put the button on so the patient can you can facilitate weaning to try to decannulate them sooner or later. This is a little tie for the trach tie. You notice this one doesn't have an inner cannula. It doesn't look like, just the obturator. Size 8 Portex Bravana. So I'm assuming this is for patients that have, maybe anatomically the airways may be a little bit narrow. They need some kind of flexion given this flexible tubing. That pilot balloon at the bottom of it, you can see it's so close, it's so well, so tight to the tracheostomy tube. But this does facilitate mechanical ventilation. Like I said, this is probably for a tall male, long neck, probably long torso. And it's not going into the torso, but you can assume that they have a long torso, they have a long neck. This is a large tracheostomy tube. Like I said, I don't see it in the cannula anywhere in the box. So, yeah, so you have to make sure you frequently suction the patient so you can maintain a patent airway. But the cap is there. I'm pretty sure you can attach the passenger valve, because you're gonna, do the passenger valve trials first before you cap the patient per speech therapy. But I work in the LTech, and I rarely see us use these Bavonas. I've seen them used years ago, but I haven't seen them much in recent days. But yeah, this is one of the options that we have for patients with long necks, maybe some kind of anatomically issues with their neck.
Hey, respiratory world. Here we have some tracheal secretions. Is there anything that you can tell from these particular secretions that we have here? This is a size 6 trach. I just changed it in the cannula. So we have some thick, yellowish, red tinge secretions. They indicate a little bit of blood. When I suctioned, I didn't get any frank blood, so it looks like it may have been a little bit of old blood there. Yeah, so this is what you have to deal with your respiratory therapist. I used to have a teacher that told me to take the secretions and rub them through my fingers to feel the consistency and the texture. See, that red tinge just seemed like it might have been a small blood vessel that burst, and it might have caused a little bit of bleeding because it's stuck to the trach, so it's a little bit of an older blood. But secretions aren't bad. The color and the consistencies aren't bad. It could be a little whiter, a little clearer, a little thinner, but not terrible. Sometimes we get a sputum sample to determine if the patient has any bacterial growth or not. They need to be put on antibiotics, but right now this patient is down on antibiotic therapy. Like I said, it's not a ton of secretion. She's been in suction maybe Q2, Q3 hour. So they are a little thick. They should be thinner. They're on patients on trach therapy. So sometimes we can increase the flow and the flow in the aerosol humidity to help thin out the secretions, or try to at least. Maybe suction a little bit more frequently to prevent any mucus plugging, maintain patent airway. But yeah.